Hey guys, I am here at our fall seminar in Columbus, Ohio, and I'm with Dr. DeWitt Wilkerson. Just wrapped up the morning session and we're getting ready to start the afternoon, but wanted to grab you for a few minutes, ask you some questions. Dr. Wilkerson has been chairman of the Dawson Academies. Well, you started with them in '82, but you are currently the chairman now. Talk to me about some of your experience there, what that's been like. I mean, 30 years, right?
Yes, well, Dr. Dawson is an amazing man because of the fact that he is so committed to excellence in every way, to taking care of patients as they deserve, getting the very best care that they can. And then dentists, as they've been attracted to that training, have come just by the droves because I think there's a real hunger by many to do things right. And so as a result of that, we've had an opportunity to train thousands of dentists through the years and help them experience the fulfillment of doing dentistry in a way that is way above usual and customary.
Yeah, and I know, what are some of the conversations? I mean, as chairman, what does that involve? Kind of what's your role, and what are some of the things you're even looking at in the future, the next 5 to 10 years? Like, where is it that you guys are moving to?
Actually, I'm chairman of the Dawson Foundation, which is our charitable arm.
Okay.
But as an organization, the Dawson Academy, what we're seeing is a need to move out geographically.
Okay.
And so we're reaching out. We're doing a seminar next week in Anaheim, California. John Cranham and I are. We are meeting in locations such as Chicago and Chesapeake, Virginia. We have classes in England over near Liverpool and Manchester, and also in Denver, Colorado. So we're trying to spread our wings a little bit and get out to geographic areas to set up pockets of focus of this philosophy of practice and care.
Yeah. What I know too, probably over the last 30 years, you guys have seen dentistry change a lot. Yeah, so I mean, even the next kind of 10 years in dentistry, what are some of the things you're seeing? I mean, but just based on your experience of where it's come from, I mean, are you excited? What's some of your outlook?
I couldn't be more excited to be in dentistry, but dentistry is changing, and some of the things that are changing, and of course the economy has been a factor, and so what we don't see changing, in fact we see a positive, is that patients in our country are concerned about their health and are willing to invest in their health. And so as we focus on establishing and maintaining optimum health, we've seen a very positive response from patients. And I think in the future, the emphasis is going to be on dentists being physicians of the masticatory system, taking care of the things that are creating instabilities, their bite, their joints, their muscles, parafunction, clenching and grinding, habits like that, things along that line, which are definitely cores in our profession, but to some degree got lost a little bit behind porcelain.
Yeah.
And so as we're seeing some of that emphasis fading a little bit, I think it's really a healthy transition toward form and function going together rather than just white.
Yeah.
So I think that we're going to see a different level of care being required among dentists, a different level of being involved in making sure patients are having great experiences, that we're being thorough, and that will be expected. We have patients coming in now that have been on the internet. You know, they know what the standards are and what should be expected and what the materials are and all these various things. So we have an educated group of patients who are seeking out top-notch care in many cases, maybe more than dentists realize. And there's going to be a niche there for those that are willing to be the best they can, where it's actually less competitive than those that are trying to do usual and customary.
Yeah. Well, I say we love that whole conversation of oral health and optimum oral health, and that's one we have with our clients all the time. It's not just about teeth, it's really about dentistry, it's about quality of life and even longevity in a lot of cases. So I love that whole segment this morning. So we're going to let him get started here. He actually came from sunny Florida and showed up to probably our coldest, rainiest day of the year yet. So, but we've got a great seminar here, and we're going to get started back.